Uh, Ms. Rashonda Young, I want to thank you for your very poignant story about your ACA premium tax credits expiring, making your cost go up $498 a month in the midst of you being a breast cancer survivor. And you remind us that right now millions of Americans are watching their health care costs explode because Republicans chose to let the ACA enhanced premium tax credits expire. Families are being forced to downgrade their coverage, take on crushing deductibles, or go without care altogether. Small business owners like yourself and self-employed workers are being punished simply for trying to stay insured. In my home state of California, we can already see the consequences. Covered California has found that when people are forced out of silver plans and onto bronze plans because premiums have become unaffordable, out-of-pocket costs double on average. For pregnancy and delivery, that means more than $3,800 in additional costs. For breast or prostate cancer, it means about $1,800 more just to get the same care. So I want to say this plainly. Any minute this committee spends not focused on fixing this ACA premium crisis is a waste of Congress's time and the American people's time. We know what the problem is, we know what the solution is, and every day we delay, people pay the price with their health, their financial security, and their livelihoods. So now I'd like to turn to an issue that is very dear to me. Today marks the anniversary of the Supreme Court's Roe v. Wade decision, a landmark ruling that for nearly half a century recognized a constitutional right to abortion. It's been 4 years since that right was stripped away, and the consequences have been devastating for people across this country, particularly those living in states with extreme abortion bans. In the wake of the Dobbs decision, access to contraception has become more critical than ever, as it's often the only remaining tool that women have to control their reproductive health. As chair of the Reproductive Freedom Caucus Contraception Task Force, I've spent years pushing it back against the insurer non-compliance with the Affordable Care Act's contraceptive coverage requirement. But women are still being denied coverage for newer, innovative contraceptive products that are required by law to be covered at 100%. Just in this last year, United Healthcare and Blue Shield of California were both subject to enforcement actions and fines for illegally charging, cost-sharing, or denying coverage for contraceptive care in direct violation of federal and state law. Under federal law, insurers are required to cover all FDA-approved contraceptive methods when prescribed by a physician with zero out-of-pocket cost to patients. Yet many insurers remain persistently non-compliant, imposing formularies, administrative hurdles, and cost-sharing that unlawfully restricts access. So I'd like to ask Mr. Hemsley and Mr. Markovich, what can you do to remove the hurdles that your organizations have in place for contraceptive care? And will you commit to removing the hurdles that have made accessing contraceptive methods more difficult? Mr. Helmsley.
Yes, thank you for the question. I was not aware of that situation specifically. We will abide by the law with respect to coverage in this area, and I will go back and make sure that that is enforced in our organization.
I deeply appreciate that. Thank you. Mr. Markovich?
Oh, yes, we abide by all federal and state laws and regulations. We certainly will this one, and the only reason that happened is human error, and we just need to address it.
Thank you so much. And now I'd like to ask about vaccines, because we all know they are the most effective and cost-effective tools in modern medicine, preventing serious illnesses, reducing long-term healthcare costs, and protecting public health. But recently, HHS Secretary RFK made the ill-informed decision to drop the longstanding recommendation that infants be given hepatitis B vaccines at birth. Because of this seriousness of this move, I had a letter where 100 Democrats requested the GAO do a study on the ill effects. One thing we do know is that it will damage many Asian American, Native Hawaiians, and Pacific Islanders, who are only 7% of the US population, yet account for 60% of these cases. So I want to ask each of the CEOs today, will your company commit to covering vaccines recommended by a patient's physician, including the hepatitis B birth dose vaccine, with no cost sharing, regardless of whatever decisions there are, but because these are very important for public health decisions?
Yes.
Yes, we abide by all, historic vaccine coverage. We have comprehensive coverage, and we allow the consumer and the doctor to make the decisions.
Yes, there's no change to our policy.
Our coverage has not changed. We abide by all laws and also decisions to be made between clinics and patients, and we follow ACIP and other society.
Similar for us, our policy has not changed. We have comprehensive coverage.
I deeply appreciate those answers. Thank you.
Mr. Hearn.
Thank you, Mr. Chairman, for holding this hearing. Thanks